Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas with your tutor DrShehla Aman. In today's class we are going to discuss with the development of the venous system of the heart. So this is the diagram of the heart. The learning objective for today's class are to describe the development of the venous system, including both the inferior vena cava and the superior vena cava, discuss the congenital abnormalities in the venous system, and then the fetal circulation. So first have a look on this diagram. There in the developing embryo, there are usually three paired veins that drain into the primordial heart. The one are the vitelline veins, also called the omphallomesenteric vein, which are draining from the yolk sac into the right horn of the sinus venosus. Then the next set of the vein are the umbilical veins, which are carrying the blood from the placenta through the umbilical cord into the right horn of the sinus venosus. And third pair of the veins are the anterior and the posterior cardinal veins, which are draining the cranial and the caudal part of the body, and these two veins join to form common cardinal vein, which again enters into the sinus venosus. So these are the three paired veins, both on right side and of the heart and on left side of the heart initially. Then there are the modification in these veins. So in this diagram, you can see these are the two vitelline vein, the left vitelline vein and the right vitelline vein. These are the umbilical veins which are present on each side, and these are the anterior and posterior cardinal vein joining to form the common cardinal vein, and this is the sinus venosus. So initially what happens that there is the anastomosis between the right and the left vitelline veins around the duodenum. So in this diagram you can see there is a shunting of the blood from the left side of the sinus venosus to the right side of the sinus venosus. As a result of this shunt of the blood, the proximal portion of the left vitelline vein disappears, and the proximal part of the right vitelline vein form the right hepatocardiac channel, which form the part of the inferior vena cava. Also look at this diagram. You can see these are the developing liver cards which are forming in the septum transversum, and when these cards grow, they disrupt the passage of the vitelline veins, and then they form the sinusoids in the liver. So the sinusoids are also formed by the vitelline veins. Similarly, vitelline veins are forming the anastomotic channels around the duodenum. So with the obliteration of the proximal part of the left vitelline vein, and there is the proximal part of the right vitelline vein forms. Later on, this part of the left vitelline vein, this is the distal part, is also obliterates, and with the changes in the sinusoidal system, another vessel develops which is called the ductus venosus, which shunts the blood from the umbilical into the inferior vena cava. As a result of the changes in the venous system, so the right vitelline vein forms the portal vein and then the superior mesenteric vein. So in this diagram you can see the distal part of the left vitelline vein also disappear, and here you can see the proximal part of the left vitelline vein also disappear. The right vitelline vein persists, and it forms the sinusoids in the liver, as well as the portal vein and the superior mesenteric vein. Similarly, there are changes in the umbilical vein. Initially, these are the two pair vein, the left umbilical vein and the right umbilical vein. With the development of the heart, the right umbilical vein disappears, and the only passageway which is carrying the blood from the placenta is the left umbilical vein. Here you can see this is the left umbilical vein, and the proximal part of the left also disappear, while right one completely disappears, and the blood is coming from the placenta through the left umbilical vein, and it bypasses the liver sinusoids through the ductus venosus, and it enters into the right hepatocardiac channel. So these are the changes in the umbilical veins as well as into the vitelline veins. So right hepatocardiac channel forms the hepatic portion of the inferior vena cava. Right umbilical vein regresses completely. Here you can see the right one completely regresses. Proximal left umbilical vein also regresses, and the only part which remains is distal part of the left umbilical vein, which persists and which carries oxygenated blood from the placenta into the body of the embryo. The ductus venosus will form a shunt which carries oxygenated blood from umbilical vein into the inferior vena cava. So now we are discussing the cardinal venous system. So initially we have anterior cardinal vein and the posterior cardinal vein, and these two cardinal veins are joined by a common cardinal vein and they enters into the sinus venosus. This is the diagram at the 5th week of development. So what happens next, that another vessel appears, and this vessel is the subcardinal vein, and this vessel then have an anastomotic channel with each other and also with the developing with the posterior cardinal veins in the area of the mesonephros. So basically posterior cardinal vein supplies, it is the blood vessel of the mesonephros, and it almost completely disappears with the regression of the mesonephros. A small part persists. So up till now we have studied the anterior cardinal, the posterior cardinal, the anastomosis between the posterior cardinal forming the iliac veins and the subcardinal veins which are joined to each other by subcardinal anastomosis and which are joined to the posterior cardinal vein via subcardinal posterior cardinal anastomosis in the region of the mesonephros. Now another set of vein appear. This yellow color, this is the supracardinal vein. This supracardinal vein then forms an anastomotic channel with the subcardinal vein. Here you can see this green color area. This is the supracardinal anastomosis, and this anastomosis forms, and later on also it will on the right side it will contribute to the formation of the inferior vena cava. So what happens next, that this one is the posterior cardinal vein. As I have told you, almost completely it disappears. The small part which forms is the root of the azygous vein, and also the common iliac veins in the right and the left iliac veins are formed by the posterior cardinal vein. Similarly, this one is the supracardinal vein, and supracardinal vein, the anterior cardinal also disappears in this region. So this anastomotic channel is lost, and this supracardinal vein then forms the hemiazygous vein and the azygous vein. Here you can see azygous vein. The stem or the root of azygous vein is formed by posterior cardinal, and remaining part is formed by the supracardinal vein. And again you can see this was the junction. This green color area shows the anastomotic channel of the subcardinal and the supracardinal vein. You can see this, and this area on the right side is formed by the supracardinal vein. This is called the post-renal segment of the supracardinal vein. On left side, this supracardinal vein also disappears, and also the subcardinal veins also regresses. On left side it forms the left suprarenal, left renal and left internal spermatic or ovarian artery. On right side, this will contribute to the formation of the inferior vena cava. Also look at this diagram. This one was the common cardinal vein on both sides, the anterior and posterior cardinal vein. Then an anastomotic channel appeared. This is the anastomotic channel between two common cardinal veins, and when on the left side the anterior cardinal vein disappear, this anastomotic channel will form the left brachiocephalic vein. So in this diagram you can also see the part of the anterior cardinal vein and common cardinal vein will form the superior vena cava. Here you can see this is the superior vena cava. So superior vena cava is formed by part of the anterior cardinal and common cardinal vein, and this whole is the inferior vena cava. This is the renal segment of the pre-renal segment, then renal segment, and then the post-renal segment of the inferior vena cava. So the origin of the inferior vena cava according to Gray's anatomy is different parts which are forming the inferior vena cava. So first is confluence of the common iliac vein. Here you can see the confluence of the common iliac vein. The next is the short segment of the right post cardinal vein, which is over here. This area is forming the second part which is forming the inferior vena cava. The third is post cardinal supracardinal anastomosis. This is the junction of yellow and blue color. So this junctional area which is formed by the anastomosis of the supracardinal and the posterior cardinal vein. This is the third site of the origin of the inferior vena cava. Fourth is then right supracardinal vein. This yellow color area is the fourth origin from right supracardinal vein. Fifth is the right supracardinal and subcardinal anastomosis. This is the junction area. The green color area shows the anastomotic channel. This is formed by the anastomosis of the subcardinal and the supracardinal. So this green colored area is actually the anastomosis which is formed between the subcardinal and supracardinal vein. The sixth origin is the right subcardinal vein, and seventh one is the hepatic segment of the inferior vena cava. So these are the seven actually origin of the inferior vena cava according to your Gray's anatomy. So first is the confluence of the common iliac, then the anastomotic point of the short segment of the right supracardinal, then the anastomotic point of the right supracardinal and the posterior cardinal vein, then the supracardinal vein itself, then junction of the supracardinal and subcardinal, then subcardinal, and then the hepatic segment. Also you can see this is the superior vena cava which is formed by the anterior cardinal vein and part of the common cardinal vein. This one is the brachiocephalic vein which is formed by an anastomotic channel between the two common cardinal veins, and because of the disappearance of the common cardinal vein, it will form then the channel which will drain the blood from the left side of the body into the superior vena cava. These are the yellow color show this is the hemiazygous vein and this one is the azygous vein. These were actually the supracardinal veins which disappears in its proximal parts, and here on the left side the supracardinal also disappears. The subcardinal vein forming part of the inferior vena cava and also forming part of the gonadal arteries. So these are the origin of the cardinal veins which are forming different parts in the embryo. And next we are looking at this diagram. This is actually the initially when the these two are equal on both sides, three pair of the veins which are entering into the sinus venosus, and this is the symmetrical organization. Here you can see the anterior, the posterior, and the common cardinal vein, the vitelline and umbilical vein. In this diagram you can see the right umbilical vein disappear, the proximal part of the left vitelline also disappear. This one is the right umbilical, this is the left umbilical, and the vitelline, left vitelline which completely disappears. This is the left horn of the sinus venosus, and because of the shunting of the blood from left to the right side, so right side enlarges. This is the part of the ductus venosus. This is ductus venosus, and this one is the umbilical arteries carrying the blood from the placenta, and which shunts the blood through ductus venosus into the inferior vena cava. Here you can see also this is the inferior vena cava. This one is the root of the azygous vein. This part is this, we are looking on the posterior aspect of the heart. So this is the superior vena cava, and this is the left brachiocephalic vein, and this one is the coronary sinus. So now we are moving to the anomalies in the development of the heart. We are looking again on dorsal aspect of the heart. So this is the left superior vena cava. In this direction, in this case, the anterior cardinal vein on the right side usually disappear, and left one persist, and left one will form the left superior vena cava. Another anomaly is the double superior vena cava, in which left on the right side it normally forms, and on the left side left common cardinal and anterior cardinal vein persist, and the left inferior vena cava enters through coronary sinus into the right chamber of the heart. So these are the anomalies related with the development of the inferior vena cava. So here you can see the double inferior vena cava. As I have told you that the supracardinal veins usually disappear on left side and persist and form part of the inferior vena cava. So in this case, the communication between the supracardinal do not forms, and the supracardinal vein persist on both sides, and it will form the double inferior vena cava. In this case, there is the absence of the aortic segment of the inferior vena cava. As a result of absence of hepatic segment, the azygous vein and hemiazygous vein enlarges, and they carry blood through this part of the inferior vena cava through azygous vein into the superior vena cava, and then the blood enters into the right atrium. So this was the initial diagram which I have told you, and in this you can see this part of the supracardinal vein disappears normally, and when it will persist, it will form the double inferior vena cava. Now we move on to the fetal circulation, which is very important, and each and every line of this part of the lecture is your MCQ. So please listen carefully. So now we are first I will tell you about the fetal circulation in embryonic and fetal life, and then what happens when the baby is born. So this is the placenta, and these are the umbilical vein, and this is the umbilical vein which is carrying oxygenated blood from the placenta. This is usually 80% oxygenated. This blood vessel, this umbilical vein enters, and it shunts the blood through ductus venosus into the inferior vena cava. There is little bit mixing of the blood in the liver as well, but a small amount of mixing occurs over here, and most of the oxygenated blood enters through this shunt into the inferior vena cava. From the inferior vena cava, these bloods enter into the right atrium. And here you can see the valve of the inferior vena cava, which is present in the right atrium. This valve help and direct the blood through oval foramen into the left part of the left atrium. So this is the valve of the inferior vena cava, which is directing the blood from right atrium into the left atrium. Also the crista dividens is also present over here, which also guide this blood to enter into the left atrium. From the left atrium in the right atrium, first in the right atrium, the blood, deoxygenated blood, is coming through superior vena cava as well, and there is a little bit mixing of the blood over here as well. This blood then enters into the left atrium. From the left atrium, it enters into the left ventricle, and then into the arch of the aorta, ascending aorta and arch of aorta. So here you can see initial vessels of arch of aorta are carotid and the coronary vessels. So heart and brain both receives well oxygenated blood. After the origin of these two vessels, there is a mixing of the blood. So you can see the blood which is returning through superior vena cava. Look at this area which is deoxygenated. It enters from the right atrium into the left atrium, and then through the pulmonary vessels through the ductus arteriosus into the arch of aorta. So here major mixing of the blood occurs, and this mixed blood then passes through descending aorta into, it is distributed into different parts of the body, and then it is returning back through umbilical arteries into the placenta for the oxygenation. So the colors show, red color show the fully oxygenated blood, highly oxygenated. This purple color show medium oxygenated blood, and this blue color show the poor oxygenated blood. So these are the different vessels. Here you can also see these are the common iliac vessels which are draining the deoxygenated blood from the lower part of the body through the umbilical arteries into the liver, and here the mixing also occur. So this is the initial circulation which is occurring in the fetus. At usually mixing occur first in the liver, second mixing occur in the in this part, that is the right atrium, and then the mixing occur in the descending aorta, arch of aorta and descending aorta, when the blood is coming through the ductus arteriosus. So what happens after birth when the baby takes first breath? So what happens? As a result of the first breath, the blood is usually channeled through the pulmonary vessels into the right and the left lung for oxygenation. The pressure changes, and because of changes in this pressure, the septum primum and septum secundum, which have a slit-like opening in between called the oval foramen, they are pressed against each other, and the oval foramen is closed. Also, because of the different factor, the right umbilical vein which is present over here, this also disappears. It also closes, and this form the round ligament of the liver, also called the ligamentum teres. Similarly, the ductus venosus also becomes scarred, and it is called the ligamentum venosum. So these two are very important MCQs, that the umbilical vein forming the round ligament of the liver called ligamentum teres hepatis, and the ductus venosus forming the ligamentum venosum. Also, the foramen ovale closes because of changes in pressure. Pressure rises on left side because blood is returning from the both the lungs, which is oxygenated, and because of this rise in pressure, both the septum primum and secundum are pressed against each other, and it will close the foramen ovale. So also remember, this closure of the foramen ovale is a temporary in initial few weeks of the life. So when baby cries, there is a shunting of the blood and mixing of the blood through this foramen ovale, and there are these cyanotic attacks in the babies as well, which you may have seen in many babies which are crying in early few weeks of the life. Later on, because of the intimal proliferation and because these two septum fuses with each other, this area closes. Another closure, another change occurred, that is the ductus arteriosus, which were carrying the blood from the right ventricle through ductus arteriosus into the arch of the aorta. So this ductus arteriosus also closes, and it will form the ligamentum arteriosum. So these all the derivatives of the vessels which closes after birth, these are all short MCQs. So please remember. So now I will explain the whole circulation in the newborn baby, that the oxygenated blood is now coming from through the pulmonary vessel from lung into the left atrium, into the left ventricle, through the ascending aorta, arch of aorta, and distributed into the body. And then they are returning through the common iliac and then the inferior vena cava into the right atrium, also through superior vena cava, also into the right atrium. So another important point to remember is these are the umbilical arteries which were returning deoxygenated blood from body to placenta in the fetal life. So when the changes occurs in other vessels, the changes also occur in umbilical arteries. So the distal part of the umbilical arteries disappear and it will form the medial umbilical ligament. This is very important MCQ, please remember. So medial umbilical ligament, this is not median. Median is the derivative of the urachus. Please remember, you students always confuse these two ligaments. Median umbilical ligament is the derivative of the urachus, while medial umbilical ligament is formed from the distal part of the umbilical arteries, and proximal part of the umbilical arteries will form the superior vesical artery. Okay, so these are the changes which are occurring in different vessels before and after birth. Again, another beautiful diagram showing you the changes, the blood carrying through the umbilical cord. This is umbilical vein, this is the ductus venosus entering into inferior vena cava, where mixing occurs also over here, then into the right atrium, into the left atrium through oval foramen, from left atrium to left ventricle, and then to ascending aorta. Also mixing occurs through the ductus arteriosus. So this diagram is actually a revision. So these are the pressure changes which are happening. The oxygenated blood which is carried through umbilical vein is 80% oxygenated. Here, because of mixing, it is 67% oxygenated, and this 67 is entering into the right and the left atrium and then into the arch of the aorta. So mixing occurs because of the ductus arteriosus, and this becomes 62%, and later it becomes the 58%. In the inferior vena cava, it is usually 27% oxygenated. This 58% from the descending aorta, then it is going through umbilical arteries into placenta for the oxygenation. So these are the different changes. Here, this is the diagram which is showing you the crista dividens and the valve of the oval inferior vena cava, which is guiding the blood from the inferior vena cava from right atrium into left atrium through the foramen ovale. So these are different changes which are occurring, and these all are very important MCQs, not only in your professional exam but also in your part first examination of the FCPS as well. And also this is very important slide, especially for those students who are preparing their FCPS part first examination. So the closure of the ductus arteriosus, this is very important. You must remember it occurs in two stages. First stage from 10 to 15 hours, and second stage takes 2 to 3 weeks. So these are your MCQs, and these points are taken from the Gray's anatomy. So what are the factors which are causing the closure? These are the increased oxygen tension, increased plasma catecholamine concentration, suppression of prostacyclin, also called PGI2, switching off the prostaglandin E receptors, synergistic role of F2 alpha and oxygen concentration. They are acting both of these two in synergism, and decrease in plasma adenosine concentration. So please, dear students, please remember these all factors are very important from MCQ's point of view for your part first examination of either FCPS or you are going for the USMLE examination. So you must remember the factors which are responsible for closure of ductus arteriosus are very important MCQs. So look at this diagram. This is again another revision diagram. Here you can see the umbilical vein, the vessels in the liver. This is ductus venosus. This is right and left hepatic veins, and this one is the inferior vena cava. Here you can see the ductus venosus, which shunts the blood from umbilical into the inferior vena cava. And in this diagram, this is the X-ray. You can see the umbilical artery, umbilical veins, and all these structures. So here I complete my today's class. Also the development of cardiovascular system is completed over here, and the references for the today's class and for whole of the cardiovascular system are mainly the Langman's medical embryology. You should also study the developing human by the Keith L. Moore and Prasad. Also the Grey's Anatomy by Susan Stranding's 40th edition, a very good book to help you for a clear concept. So thank you very much dear students for your attention for the today's class, and Allah Hafiz till we will start another system. Thank you very much.